Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello everyone, I am Dr. Sanjeev P. Sahni and today we will be discussing about prolonged grief disorder, which is also known as PGD. Talking about grief, grief is a common human emotion and a natural response to loss. Unlike depression, prolonged grief is marked by a pervasive and persistent yearning, longing for the deceased person. If we look for statistics surrounding PGD, according to a 2017 meta-analysis, PGD may affect as many as 10% of people who have lost their loved ones. Evidence suggests that about 1 in every 10 bereaved person develops PGD, which is a pretty high number. PGD was recently added to the Diagnostic and Statistical Manual of Mental Disorder. It is called DSM, which classifies PGD as a condition which can happen when someone close to the bereaved person has died within at least 6 months for children and adolescents and or within at least 12 months for adults. Looking at some symptoms which classifies PGD, the bereaved individual may experience intense longings for the deceased person. 2. Preoccupation with thoughts of the deceased. 3. These grief reactions occur throughout the day, nearly every day for at least a month. The individual may also experience clinically significant distress or impairment in social, occupational, or other important areas of functioning. We all know how the pandemic affected various aspects of our life. Many of us might have lost our loved ones, leading to grief, despair, hopelessness, and helplessness. Social isolation too break down the support network and triggered feelings of loneliness. People were unable to be with their loved ones when they needed help or breathed their last, or sadly were unable to attend their funeral services due to the restoration posed by the pandemic. This also led to a spike in number of people suffering from PGD. Self-care is a critical component in the grieving process. In addition to seeking professional help, try considering small things you can do to take care of yourself, such as stick to a daily routine, indulge in physical activity daily, eat a healthy and balanced diet, restrict or avoid alcohol use, practice mindfulness meditation, spend quality time with your loved ones, incorporate at least one thing in your daily routine that brings you joy, peace, and makes you feel content. Apart from these, if you feel that you suffer from PGD, seeking professional help is a must. What is it about? Therapy for grief, or grief counseling as it is often called, is designed to help in the process and in coping with a loss, be it loss of a friend, family member, pet, or other life circumstance. Grief counseling caters to all kind of population ranging from children to old age. Cognitive behavior therapy is one such method which is widely used treatment approach for mental health conditions such as depression, anxiety, post-traumatic stress disorders. Acceptance commitment therapy may also be helpful if you deal with intense or prolonged grief, since it encourages clients to use mindfulness approach to accept their experience and deal with it effectively. Grief counseling for children. So, grief counseling for children is distinct now how it is delivered to adults, because children are much more vulnerable, sensitive and need to be dealt differently. Here are some of the therapies used for kids. Play therapy are also being used by children. Most instinctive behavior of interacting with the world around them by incorporating play. A therapist may use dolls, puppets, stuffed toys, dollhouse, etc. to encourage the child to communicate their thoughts, feelings, inhibitions, confusions and concerns which they may otherwise struggle to express in a typical talk therapy. In art therapy, which allows a child to express themselves using their creativity without using words, a therapist may ask a child to draw or paint a picture of the person they are grieving for and then use it as thoughts associated with it. Several books deal directly with death, but in a child-centric manner. A therapist may use books to help a child know about death and dying and ways, the associated concepts, and guide them various ways in which they can move forward. Since grief is a common phenomenon and has severe repercussion if not dealt with caution, it's extremely important that to cater to it timely and seek professional guidance if it becomes severe. That's it for today. Stay tuned to JIBS Infotainment for more videos, documentaries and discussions. Thank you.